have our Council of Governors public meeting. Welcome to all our governors and other participants, and any of you who are watching today, you are very welcome. So I will begin the meeting. Firstly, we have apologies for absence. Are there any apologies, please?
Yeah, we have Fiona Sanders, John Cunnington, Mandy Darley, Jack Hudson, Craig Enderby, Andy Barber and Paul McCart.
Thank you very much, Jenny, for that. We move on to declarations of interest. As colleagues will be aware, if there are any changes to the declaration, could they inform the Trust Secretary? And if there are any items on the agenda which cause a conflict of interest, could you please declare and remove yourself from the meeting for that item? Okay, we're moving on to the minutes of the meeting held on the 8th of July. Are they an accurate record? Thank you. Are there any matters arising? No, thank you very much. Those are received and approved. And now we move on to my report. My first report for the Council of Governors. As you all know, I started officially on the 16th of September. It's been a pretty busy few weeks. I've been trying to meet as many people as possible. The Bands 3-7 Leadership Forum, New Starters Welcome Induction. I did one myself as a new starter in the summer, but at this one I was with Michelle playing my part to welcome new starters to the Trust. I've met Grace Garver, the chair of the BAME Network, in the past week, and was with Michelle at the Black History Month launch, and I'll be doing an event next week for Black History Month. I was really pleased yesterday to take part in my first quarterly staff awards for long service. I got some music accompaniment there. Thank you. I wasn't sure whether that was a fanfare, but was that Jean? Thank you. And it was great to hear from staff about where they started their career in the NHS and what they are doing today. And that was really great to hear their stories. Next week, I think it's next week, we're having a Meet Caroline event, and I'm going to be visiting Whitby in person. And I've got a virtual visit to Millview Lodge coming up too, and we're trying to arrange others over the weeks and months ahead. I attended an East Riding Health and Wellbeing Board workshop, which was really interesting to meet some of the people that I'll be getting to know a lot better, I'm sure, over the months ahead. And we had a discussion around what actually does integration mean within the ICS, and that was quite a very interesting discussion. I think what I took away from it was that obviously there's a lot of discussion about structures and frameworks, which is very important. But I think again, particularly from some of the councillors there, was a feeling that, you know, come 1st of April next year, it would be good to show some progress on some practical outcomes as a result of all this collaboration and coming together. I also had another meeting with Stephen Eames and attended the Humber Coast and Vale Chairs and Members meeting. And just to let you know, I've also taken on from Sharon Mays, the former chair, her role in developing ideas for the structure of the Humber Coast and Vale Integrated Care Partnership. And I've had a meeting with Councillor Michael Harrison and Karina Ellis from NHS Hull CCG. We had the annual members meeting. It went well, apart from there was a bit of a technical hitch, which meant that I couldn't actually enter the annual members meeting. So I'd just like to put on record my thanks to Sam, our lead governor, and Michelle for taking up the pressure and the reins to cover that event. I'm very pleased, though, to let you know that I did attend the virtual market stall earlier, and it was great to visit 4 of the stalls there and to hear from others for both clinical and non-clinical about some of the work they do in the Trust in more detail. Thankfully, when we got to the Trust board meeting, the tech was all sorted. So my thanks to the IT crowd for that. And we had a good and comprehensive board meeting the other week. I just want to flag up with everybody about the governor elections. A reminder that nominations close on the 21st of October. We have vacancies in Hull, East Riding, and amongst service user and carer and non-clinical staff. And of course, I'm sure you're all getting out there and encouraging people, but if you know anyone who may be interested, and for those you watching today as well, please look out for the details on our website, or you can contact the membership officer, Katie Coleraine. One of the issues that's come up actually is I've been working with Katie and others, is that some governors can't make Thursdays going forward. So I just wanted to put it out there today to ask governors to maybe think about whether they think changing the day of the meeting to a Tuesday or another day is preferred. I'm not asking people to come back on this now, but I'm just interested in people's views about, you know, the time. It's really difficult getting something that meets everybody's schedules, but as some governors were worried about that going forward, that would prevent them standing, I just thought I'd just raise that today. Another important part of the work I've been involved in the last 2 weeks is the recruitment for 2 new non-executive directors. Sam and I have been working on that. Thank you, Sam, for your input on the job specs and the advert and the schedule. We had an appointment terms and conditions meeting as well to talk about this further. And you will have, I hope, been circulated with some times for your involvement going forward. So the governor's stakeholder panels, just as a reminder, are on the 15th of November for the audit chair and the 29th of November for the other general non-executive director vacancy. So if you'd like to be involved, please let Katie know. We can't confirm the timings yet because we can't do that until shortlisting has taken place. But we wanted to give you a heads up on those. And also an extraordinary Council of Governors meeting to ratify appointments. The date we've identified for that is the 7th of December. And I thank everybody who's worked very hard in trying to get the timetable for these dates and the other dates in the process together. Strategy refresh, that is well underway, and there's been a number of events being held and developed for staff and other stakeholders. I'm pleased that I attended the Council of Governors Development Day on the 14th of September, where the strategy refresh was discussed. And there was also a very good discussion, I thought, on staff training. I was really pleased to have been able to listen to those contributions on that day. It is Freedom to Speak Up month, October as well. And I just wanted to let you know, because I was in a meeting with Alison Flack, our Guardian, earlier. She is planning a meeting with staff governors soon. Again, they've got a number of activities organised. So that really is my report. I hope that's helpful, and I hope if there's any questions or just to take note. Thank you. Okay. So we move. Oh, have I missed someone? Helena, sorry.
Yeah, it was just, I mean, I don't know if you'd be able to answer it or somebody, but one year we had like little postcards we gave out about becoming a governor at Humber, and we could stick them through relevant people's doors. And I just wondered if there was any feedback as to whether that campaign was successful, and if so, could we do it again? Because I found it really useful, sort of handing them out to people I thought might be interested. They probably never were because they never stood, but just in case.
I don't know the direct answer to that. I don't know if anybody else can help with that. Michelle?
I'm not sure how successful it was, Helena, but obviously we've got the complexity of COVID now, and actually handing things out, etc., makes it more difficult. But I'll get you a response and we'll send it round. But I don't think it was that particularly successful. But we have got leaflets and things that we have at HQ, and I know that we're mentioning it everywhere because I've mentioned it in my blog, for example. But we've just got to be careful handing things out directly and what have you. But I'll get a final response to you.
And are we putting it out on Twitter and things? Because I know we're not very good at doing that.
Yeah, we are, and I'll check that that's happened on Facebook as well. I think comms have got hold of it, so I think there's a whole full social media piece. But I will just double check the whole of. In fact, if we send the comms plan out to the governors, I think that might be helpful, Caroline. So I'll get that sorted.
Yeah, I think that's a good idea, Michelle. Thanks for that. Thanks for that question, Helena. Any other questions on anything I raised? Okay, then we'll move on then in that case. Hang on a second. Move on to the Chief Executive's report.
Thanks, Chair. Good afternoon, everybody. I'm just that you've read the report. I'll pick out a couple of things as usual. Visits are continuing virtually, as I've been doing all the way through the pandemic, but I am doing a few more face-to-face ones. I've done the odd one over the last 18 months or so, but we are doing a few more now, and that continues to be really good. Staff are still doing a fantastic job, are still tired, as we know. And there's lots of work that we're doing in relationship to health and wellbeing and supporting staff alongside recruitment. And it is in here somewhere that we have recruited our first round of international nurses, which is fantastic. They're across, I think they're just about to come out of the quarantine period. I've met them virtually and they are just fantastic. And the wealth of experience that they're bringing into the organisation is phenomenal. And I really look forward to seeing them as they progress through their journey. They've got the OSCEs, which is a formal examination in relationship to registering on here. And if you remember, they're going to be working closely with us in our community services, and we're already on with our next cohort. So that's really good. Hopefully, governors saw the celebration week that we did for staff. That was on the back of asking staff about the award ceremony, but it also builds on the work that we've been doing throughout the last 20 months in relationship to monthly rewards and acknowledgements of how we are valuing staff. So we focused on various areas each day and did lots of different things that accumulated in a quiz at the end of the week that went down very well. And we're probably maybe thinking about doing that quiz a little bit more often, because it was just a bit of a way for people to let off steam, and the questions were very difficult. I don't know who pulled the quiz together, but it was particularly difficult. But I'll keep you posted if we continue to do that. The youth board continues to go from strength to strength. If you remember, this is something that we set up because of our age profile, and they've decided absolutely to change their name to Humber Youth Action Group, and we'll be talking a little bit about how we can utilise that group in order to start to influence some of the work of not just the Council of Governors and the board, but wider organisation. Great that Inspire got 2 awards. For clinical, but also for the building itself. And those of you who have had the pleasure to go to Inspire, you'll know it's an absolutely phenomenal resource and facility. So that's really positive. That's been acknowledged. As always, I thank DOF and others in relationship to Whitby. It is an amazing feat that this has managed to actually come to fruition, albeit a couple of months late in the middle of a pandemic, and it looks like a new build. I know there's still work to go. I know that Josh got that hand up, and I'm sure we'll come in a second. But that's been down to a collective team effort and the patient transfer. When I was up there a couple of times, and it does look remarkable. I know there's still a bit more work to do, but the basis are there, which is really good. And we got urgent treatment centre accreditation as well. We've had 1 success in the Patient Safety Awards from HSJ. These are the Oscars of the NHS. We got 5 shortlisted, which is fantastic, because just being shortlisted, as you would know from the Oscar ceremony, is an amazing feat in itself. And we won the Children and Young People for our work on the webinar, which is really positive. There is a lot happening. I will stop there. Lynn will probably will give you an update on the COVID report. Please have a look at the research conference. I think it's full. But I'm sure we can squeeze the odd person in, so especially governors, if you're interested. Flu vaccinations are on process in earnest. We're having a weekly update of where we are. We're slightly ahead of last year's target, which is fantastic. We want to complete them in 3 weeks. We've opened it to all staff, and not just our clinical staff, all our staff, and we're starting to think about our COVID booster process, which will take place in the lecture theatre. The staff survey is also out, and as you know, I feel very passionate about the staff survey. It is a really important measure of how we're doing in relationship to our staff. There is one that comes in between now that we've just got the first cut of data, which shows the progress that we've been making has been sustained, which is really positive, but we'll see what happens in this staff survey. There's a full comms report there, Chair and Governors, and there's the Health Stars report as well. But I'll pause for breath. I know Doff's got a hand up, and then I'll throw it over to Lynn just to give you a brief update on COVID and the position of COVID. But if it's at the Chair's discretion, if I can just ask Doff, because it may be about Whitby. Thanks, Caroline. Doff.
Yes, I think this is the moment when I do my formal thank you for all of the work that everyone in Humber has put into making this a success. It is an absolutely fabulous facility. I have to completely echo what Michelle has said about how it feels like you're walking into a new hospital. So all of that hard work has really paid off, and I'm full of appreciation for all of the different members of the team, and particularly for Michelle and Sharon and Peter for the way that they've led and pursued ensuring that this comes to fruition. So thank you very much indeed.
No, thank you, Doff. You were absolutely amazing, and you were our eyes and ears on the ground. So don't underestimate the absolute work that you put in. It was phenomenal, and we'll continue with that as well. But thank you for that.
Thanks very much, Doff, and I'm looking forward to seeing it for myself next week, and hopefully we're going to meet up for a coffee over in Whitby as well. Okay, thanks very much. Lynn, would you like to add anything to Michelle's report?
I'll just be very brief, Caroline, if that's okay. So this report obviously covers the period of sort of late August, early September, and things have obviously changed again since then. But obviously during that period, infection rates were high in the population. Hospital admissions to acute hospitals went up in that period as well, although thankfully mortality and deaths still remained low. We saw a rise as well in the number of inpatients within our mental health beds who tested positive for COVID. That has reduced again, which is good. Not quite at zero, but close to it. Staff sickness absence has remained stable, which is good. But as we've already touched on today, staff do still feel under pressure with still quite high levels of demand across a number of service areas. And obviously we're encouraging our staff to take leave during August and September. So obviously that adds to, and we did have that, it actually sort of moved on a little bit, but that sort of pandemic of track and trace, contacting our staff where they hadn't had a direct contact, but just through the app. Now, thankfully, we did receive some changed guidance in mid-August as well that meant that we could, under certain circumstances with risk assessments in place, return staff to work. So that did alleviate a little bit of the pressures, but we still are seeing, significant and quite high operational pressures across a number of areas. Mental health actually is reasonably stable in terms of adult mental health demand. They're still high, but they have sort of stabilised and plateaued. We've also thankfully seen some stabilisation of CAMS demand. Now, we normally do over the school holiday period, so we'll watch that carefully as we are doing now. But we still are seeing those pressures in Scarborough and Rydell community services particularly, and in primary care, which is national sort of media focus on sort of GP practice primary care at the moment. Where we're really focused right now, again, is sort of managing that demand through our ongoing surge planning and emergency planning arrangements. But we've been very focused on winter. And I know when we discuss this everywhere, what winter is, sort of there is a continuous feel of winter pressures now, but even so, we do sort of take into account obviously where we are with sort of flu campaign, which we've already touched on, making sure that we're really ready for any events around adverse weather, and checking our policies and procedures and planning are all in place for those. That is what we do within the trust, but obviously we share our plans and work on our plans mutually with our partners too, to make sure that obviously if we need be, that we would receive mutual aid and we can give mutual aid across the system. I have to say we've really honed those plans through COVID. If there's been a positive, that it really has tested our emergency planning. So I think we're in, as good a shape as we can be around some of that work at the moment. And obviously we are preparing now and have a plan in place for the booster vaccination programme as well as the flu programme. So I'll stop there, Caroline. Those are the key issues, but happy to pick up any questions. And I did note obviously in the report as well around the work we've had to do around care homes, and particularly making sure that staff who enter care homes have been fully vaccinated, because that's the mandated requirement by November this year. So we have done some operational work to make sure, and we are assured that we're in a good place to manage our services in that respect.
Thanks very much, Lynn. Any question or comments on the report or what Lynn said? I can't see any hands. In that case, thank you very much, Michelle and Lynn, and that paper is noted. We move on then to item number 8, which is the Constitution. I think we have Michelle Hughes who's going to introduce this paper. Michelle.
Thank you, Chair. So this paper proposes some amendments to the Constitution following our go-live date on the 1st of October for the Trust assuming the responsibilities as lead provider within Humber Coast and Vale Provider Collaborative, which means we hold the lead contract with NHS. As members know, any change to the Constitution requires approval of both the Governors and the Trust Board. So the paper outlines 3 key updates. The first one is in relation to just reflecting in the narrative that the Trust undertakes now both provision and commissioning functions. The second one is in relation to the delegated responsibility from NHS for the commissioning and contract and quality safety oversight of the entirety of the contracts. And lastly, to reflect the role of the Director of Finance, who is the executive lead for the Trust commissioning responsibilities. So very 3 hopefully straightforward additions that reflect the new role of the Trust. There's also a note in there which just wanted to make it very clear that there's absolutely no change to the role of the Council of Governors for significant transactions. So subject to the Council of Governors being happy with those 3 amendments, they will then be formally presented to the Trust Board with the Council's approval, and once the Trust Board has approved them, will become effective immediately. Thank you.
Thanks very much, Michelle. Are there any questions or concerns about the proposals that Michelle has put forward?
Yeah.
No?
Yeah.
Tim? Oh, sorry, Tim, sorry.
Yeah, could I just ask Michelle, when it's passed by the board, could the governors have a revised copy of the Constitution sent out to them rather than trying to sort of fit this in with our other papers?
Yes, of course. It's available on the website, but for ease, I will PDF it and send it to the council. No problem.
Thanks.
Thanks, Tim. Therefore, we have is there approval for these recommendations? Yes? No objections. Thank you. That's approved. Thanks, Michelle. Moving on then to item number 9, and Hugh's with us, and he's going to introduce this paper. Thanks, Hugh.
Thank you, Caroline. Yeah, just in terms of the meeting of the Financial Governors and Audit Group, we met a couple of weeks ago. We had a really interesting presentation from Internal Audit, and we had people from Audit actually presenting and complementing the organisation's financial team and other teams for their work in contributing to the audit process over the very difficult period. And it was a joy to hear that the overall assessment of the organisation was that they were able to give significant assurance of the work that has been undertaken as part of the internal audit programme overseen by the audit committee. So that was particularly great to hear. The group then looked at the assurance reports for both audit and financial committees of the Trust. And again, we were delighted to see the robust work of both committees in working on the wider audit programme, the contribution of departments to the audit programme, and also the ongoing work on finance, including, and I think it is really important, the excellent work that is ongoing on budget reduction schemes. Because what we all realise at the group is if we don't keep the financial position on track, we cannot afford the improvements in quality that we want to achieve. And that obviously comes back to one of the areas that we have subsequently looked at, which is how can we, as a finance group, looking at the agenda, how can we better and further improve our performance. And I wrote out to all the members of the financial group, and we had a number of suggestions as to how we can improve that, and we'll be looking to do that in coming weeks. And that will include making the agenda and timing of the meeting more appropriate with board reports, so that we get a much more current picture of what the financial performance is before our meetings. And also we do look to continue an arrangement that we've had over the past couple of years, whereby the quality structure and the finance governance structure have an opportunity to meet, and perhaps that will be by using one of the development days that we have already in the diary. But overall, we had a good attendance at the meeting, really good input, and it's really fantastic to see the ongoing performance of the financial department, but also other departments in keeping us on track. Thank you.
Thanks very much, Hugh, and yes, congratulations to everyone who's been involved in helping make this such a positive outcome. And I think we're scheduled to meet up actually shortly to discuss some of the ideas that are emerging around future effectiveness. So thank you for all the work on that. Any questions, Tim?
Yes, sorry, Hugh is aware of this, and it's just a point of accuracy. I attended my first meeting on the 25th of March last year, and on the attendance list I'm not shown, so my name should be added as 1/1. It's just a point of accuracy, that's all.
Quite right, quite right. Anybody else? Mike?
Yes, Chair. Just an explanatory thing that at the end of the attendance, there is Mike Smith with a series of blanks against it. That's because it was a recent decision to put the mental health legislation considerations onto that group, and I very much enjoy and value that group, but didn't want people to think I was missing in action previously.
Thank you, Mike. Thank you. Anybody else? No? Therefore, has this a paper the approval of the Council of Governors? Yes, thank you. That paper is approved. Thanks, Hugh. Moving on then, we move on to item number 10, and we've got the Public Trust Board meetings for June and July 2021. Are there any comments about those two sets of minutes? No? Therefore, they are received and noted. Thank you, everybody, for that. And we move on to item number 11, which is a performance update. And we have Pete Beckwith with us to, I think, present this item. Pete?
Thanks, Caroline. So this is the performance report as at the end of August, and this is a report we considered at the Trust Board last week for anybody who was watching the public meeting. You'll see from the front sheet that we included commentary for those indicators that fall outside of natural variation, or where the exec lead for that indicator felt performance was worthy of a comment. You'll also notice that in this month's report is the detailed appendix on waiting times, and I know Lynn has responded to some queries on waiting times directly outside of the meeting, so I don't know whether it's worth bringing Lynn in on waiting times now, Caroline, and then moving to any questions on the report.
Yes, why do we do that? Because I know there have been exchanges, and I think that would be helpful. Thanks, Pete. Lynn?
Thank you, Chair. Yes, the particular questions were specifically related to the children's ASD, autism, spectrum disorder, diagnosis waiting times. And I guess the thrust of the questions were that the trajectory that was appendix to the IBR that went to board were on track in the main in relation to Hull. However, were behind track in relation to East Riding. So I have responded to that. And unfortunately, East Riding is a smaller service. It has a smaller waiting time. And overall, it doesn't have the length of waiting times that Hull has. either. So not that we are not focused on East Riding equally, because we absolutely are, but there also has been some sickness absence that was unexpected in what is relatively a small team. And unfortunately, the skill and experience that we need in our clinicians to undertake diagnosis is quite rightly, they really do need to have the knowledge and experience to do that safely. So we are tackling that. We are recruiting currently to the service. We're also undertaking internal training of our existing staff to address that as well. And we have added in more access to the digital clinical service that's called Helios, that's referred to in the report, which is now also focused not just on Hull, but is focused on East Riding as well. So we are doing everything we can. I can assure you that we remain very focused on all our waiting times. Obviously, I've already talked about, we do have pressures in terms of demand. So whilst we're trying to reduce waiting times, demand is high as well. And obviously that's a constant conversation that we have with our commissioners. Internally, obviously, we move resource where appropriate to manage those waiting times, but we also have constant and ongoing discussions with our commissioners around those pressures too. So we are planning some service changes around the neurodiversity pathway that we've been working on for the last year or so, right through COVID. So there is a launch of a slightly changed service that's expected to happen in January, which will bring all the neurodiversity services under one umbrella. Our expectation is there'll be some changed clinical processes around that as well, which means that we hope to, be more preventative, see people sooner, provide the support that's needed. If people need an absolute diagnosis, then that's fine, but often it's the support. And again, just to give reassurance, the clock doesn't stop on the waiting times until a diagnosis is reached. For the vast majority of children and their families that are on that waiting list, they are in receipt of support. So it's just to, I think that's a really important point as well. But I can see lots of hands now, Caroline, so I'll pause there.
Thanks, Lynn. Okay, I've got Tim and then I've got Hugh. Tim.
Thank you, Caroline. Lynn, can I just simply say thank you for your lengthy reply to my questions, and I will follow up one or two of the points offline. But I still have this concern that when you look at the whole trajectory, which thankfully is on target, it's the target that actually also bothers me, that we're talking about not getting the waiting list down until 2023. And, it just seems to me that that was a very poor ambition in the first place. We should have been actually attempting to get it down at least sometime next year, even if it's towards the end of the year, but just felt there was a lack of ambition there. So any extra resources that can be put in, and anything that the governors can do to assist in any applications for funding, if it's pressure from governors or anything like that, then, I know that the governors are themselves keen that this should be sorted. All resources, and I think whether NHS or private, should be used to make sure that this list is brought right down. I won't say any more because I know that Hugh has some things to say as well. Thanks a lot.
Lynn, do you want to hear Hugh's comment and then come back? Is it on the same area, Hugh? Yes. So why don't I take Hugh and then you maybe come back on both of them, Lynn? I think that might be helpful for the conversation. Hugh.
Hi, Lynn. We've had lots of conversations about these things before. I think one of the things for me that is very clear now is that obviously capacity in people to do the work is a huge challenge. What I know in parallel is, as well as the Helios digital system and other systems, as Tim referred to, that I now know of quite a significant amount of independent and private sector capacity that is available. Having had experience of buying and seeing systems of managing waiting lists in acute care, what I know is large amounts of money quite often get diverted, whether we like it or not, to independent and private sector providers in order to reduce waiting lists. And that's because the same clinicians work both in the NHS sector and in the independent sector. From what I understand, that is the same in the Humber regional area. And it's whether we can purchase some of that additional capacity, albeit it always makes my skin crawl, but it's something that, because the size of the challenge is so big, and as Tim said, in Hull, the challenge in terms of time as well as waiting list size is so big, whether we can actually get our hands on some bulk independent sector capacity is a real challenge. So that's one bit. The second bit is more about how we prioritize, because again, what we've now got is such a long list of people. It's how do people who are knowledgeable about the individuals clinically expedite really challenging cases. And I think this, for me, is really highlighted whereby we have special educational needs coordinators in schools, heads in special schools who can identify and have quite a lot of experience in identifying kids that really are at the end point. And they are having real challenges in clinically expediting children who are experiencing and demonstrating very high levels of need. I just think that a route for that is difficult to manage, I know from my experience, but I think there is a real problem, certainly in Hull now, because of the size and length of the waiting list.
Thanks, Hugh. Lynn, before I bring in Anne, do you want to come back on Tim and Hugh's comments?
Yeah, so on the points, Tim, you make about lack of ambition, it's not that the Trust doesn't lack ambition, as I hope you are aware around this. And a lot of the work that we have been doing lately, obviously, is to absolutely maximise the resource that we've got available to us. We did put additional resource in to fund the Helios service ourselves, as well as part of our COVID recovery planning. I noticed Pete's got his hand up too. So if we can expedite the time it's taking, and obviously nobody would want to shorten the length of time on that trajectory than me, and I know Michelle and others would exactly want to do that as well. So every opportunity that is available to us to do that, indeed, we will take it, and we'll keep revising that trajectory as well. So I think on the points that Hugh, you're making as well around the opportunities, options available to us to seek, additional capacity to do indeed the thing that we've just talked about. Of course, that's on our sort of constant agenda as well. This is a national issue. It's an issue for our ICS as well. So there is a particular programme that Michelle has commissioned to look at this across the board as well. I do think the point that you make about availability, capacity of skilled and experienced staff to want to take this particular clinical activity is a challenge. It's not just a challenge for us, it's a challenge for our ICS. And I think there is potential ICS solutions for how we sort of certainly improve the position from where it is now as well. I think the points that you raised around, I guess, Helios is the example we're using at the moment, but potentially how do we get to a place where, as a provider, we're in a position where we could provide more of that digital platform-based work as well. We'd absolutely looking at that as an option, but I am aware as well, Hugh, like you, that there are potential other providers out there as well, and believe you me, that's part of the conversations that we're having with our commissioners at the moment. I think what you say about the whole pathway, Hugh, is really key as well, that we've created a historical waiting list. I think our ambition, both across Hull and East Riding and as an ICS, is to actually not do this in the way that it's historically been done. And I think the neurodiversity sort of new commission service that should come on stream, or at least start next year, is very much about diagnosis is one route, but actually how do we pick these children and family up right across the system in education, in social care, and do better, have that support triage processing happening much earlier on in the pathway. In actual fact, to have fewer children on the waiting list, which should be our aspiration going forward as well. So Hugh, I know there's a lot there, and I probably haven't exhausted my own answer. I'm conscious of time, but again, you know, happy to share more details around sort of where we are with that work outside of this meeting, if that's helpful.
Thanks, Lynn. I mean, the email you sent to Tim that I was copied into, it might be worth thinking about sharing that with other governors too, because it covers a lot of some of these issues in more depth. But thank you for that. Anne?
Just a quick one, Lynn. In the additional information, there is a reference to the fact that we have considerable, or we have staff absence due to sickness. Have we got I don't know whether that's COVID related or other factors are influencing that sickness statistic, but do we have a theme or something that we need to be picking up on that's affecting the availability of staff? Because obviously, you know, the numbers aren't going to come down if we haven't got the staff, but if it's, you know, physical health issues, it's one thing, but is there other factors that are affecting the availability of cover?
Yeah, it's a small team, and so I don't say, but obviously just to assure you that we are looking at that. Mm-hmm. So the obviously where we can, obviously we are providing cover for that, but obviously I can assure you we are looking at that. So, but because of the small nature of the team, I don't want to.
No, that's fine. No, I don't.
Yeah.
And can I just clarify as well, with the wait times as they are, when you say that families still have access to support, is it that they have some sort of telephone? I'm sorry, I should probably know this, but do they have access to a call, a service, so that if they are having real difficulties managing in that period, they have support?
So our procedure around that, Anne, is that anybody on a waiting time, actually anywhere in the trust, is contacted on a regular basis around understanding what the clinical need is, and obviously if it's escalating, that we can get that person, you know, to the right place as quickly as possible. On this particular occasion as well, recently there's been some additional resource commissioned actually through the local authority, through Hull Council, so that we can signpost people directly to that support as well. So that's helpful too.
Yeah, great. That's good. Thank you.
Thanks, Lynn. Thanks, Anne, for that. Those questions. Are there any other comments or questions on the performance update? Okay, then that is received and noted. Finance report, Pete.
Thanks, Caroline. So this is the finance report that covers the 3-month period, which takes us up to the end of August. I think what I would like to say is just to remind the governors that we are continuing to operate in the block funding arrangement. So what that means is normal contracting arrangements between commissioners and providers have been suspended, and the trust receives a block amount of funding based on historical run rate against which we need to live in. And I think the point Lynn made on the earlier conversation about waiting times and additional investment, you know, I think Lynn made the point, and I'm going to reiterate it, the additional investment in the independent sector, we did of our own back. We weren't dependent on commissioners to support that. We used what headroom we had non-recurrent ourselves as part of our recovery plans to put that into the waiting list work. I guess what I would say from the report is you'll see that for the 3 months of the reporting period, we have hit our ICS planning target. And what that means in reality is at the end of August, we recorded a small operational surplus of 245,000, which is the target that has been set on us for the ICS to live within its means. Within the report, you'll notice our cash balance remains healthy, so it's stabilised around the 24 million mark. And you'll see that up to the end of month 5, we've spent just shy of £3 million in relation to COVID-related expenditure or income top-up for income we're not able to recover due to the block funding arrangements. I think if I stop there, Chair, and I'm happy to open to any questions on the report.
Thank you, Pete. Any questions on the report? Hugh.
Thanks, Pete. I was just wondering, one of the things you talked about in terms of block payments for the first period of the year, those block payments continue for the second period of the year. Are there any changes to the assumptions that are being given for things like efficiency targets, where I think when we've talked before, we've had a provision for making efficiency gains for the second 6 months of the year at circa 3%. Are those kind of things still in playing from the NHS E/I, or have they changed?
So planning guidance came out last Thursday.
Yeah. Okay.
The system allocations came out beginning of this week. At the moment, I've got to be careful how I say this, it's a public meeting. The system allocations are that, it's an allocation to the system. So there's a lot of unpicking of the H2 block, but there is an efficiency requirement in there. So there's a commitment to fund the pay award, but then there's an efficiency ask in H2, which on the face of it would suggest it's about 3% for the second half of the year, which is consistent with what Michelle and myself have been feeding back at previous meetings.
Okay.
Thank you. Thank you. Thanks for that question, Hugh. Any other questions? No. Thank you, everybody. That finance report, therefore, is received and noticed. Thank you, Pete. We move on to item number 13, Governor Group's feedback. Sam, did you want to report back, please?
Thank you. Yeah, the salient points have already been recorded in the papers you have in front of you, but I'll go very quickly through them. We had 2 meetings recently, and various points were discussed there. And one of the points discussed was whether the term for the governors should be changed, and whether a governor can come back as being a governor after a gap of time. And it was felt that this is something which the chair and the corporate affairs director should look at and develop moving forward. A caution was made that this would need a change in constitution, and one has to be careful that it does not have any adverse knock-on effect somewhere else. So that was that part. And then the other important thing we carried out recently was the appraisals for the chair, the senior independent director, and non-executive directors very satisfactorily. And I say that very satisfactorily because we are still friends. And the other thing is that our associate non-executive director, Hanif Malik, has already joined us. And as you are aware, we are in the process of recruiting 2 non-executive directors, and the dates have been mentioned earlier to you. The details will come, I think, in the coming weeks as we move forward. And towards the end, I have said this before, but I'll say it again. We would offer our best wishes to Sharon Mays, who left us after 7 years. But we are very happy to have the new chair, which we believe would be very good. And we gladly offer our full support to her. Thank you.
Thank you very much, Sam. Did anybody else want to add anything into the report? Doff, did you want to say anything at all?
Yes, and I put the thing in, this is about my report, the members' report. We are very keen that governors should see their responsibility towards their constituencies, one where they really do make themselves as available as possible. And as I said in the chat box, we are planning, and I'm aware that Michelle Hughes is here on the call. We did say that once the AMN had happened and before the nominations for new members closes, that we would put out a new email newsletter. So I don't know if Michelle can tell us how we're getting on with it, but we're very keen that members should look at ways that governors should look at ways that they can be in touch with the membership. So I think I wouldn't add anything beyond that. And Michelle looks like she might join in.
Shall, if I may, the second e-newsletter for governors is in development. There's a couple of articles just awaited. So because we're so close to the date for the closure of elections, the plan is that we will send a direct email to members just highlighting the vacancies and trying to encourage them. So that is part of the overall plan, Doff.
Thank you.
Thank you, Michelle, for that. Hugh, did you want to report back on the Finance Audit and Strategy Group contained within the report?
So can I just come in, Caroline, just on what Doff and Michelle were saying?
Sorry, Helen, of course you can. Sorry, my apologies.
It's just, and I know I keep banging on about it, but I think we're not very good in terms of social media for publicising things like getting members and what have you. So if there's a way of putting that newsletter on, and then people that are on social media of all types, you know, LinkedIn, whatever, can share it, and it just might be another way of getting people interested who might not have been interested. So I know I bang on about it a lot. I feel very strongly about it.
Thank you. I've actually already made an email while this meeting's been going on just to check the social media content. I have received assurance, but I'll pick up the points you've just raised, Helena.
Thank you. Thanks, Helena. I mean, maybe we can have more of a conversation about that offline as well, about which social media can get the best results. Facebook community groups, tapping into them and putting postings often is really effective. But that might be being done already, so I don't want to presuppose it isn't. But thanks for that, Helena. Hugh,
No, I'm fine, as I jumped the gun earlier and reported back on this group. So
great.
I refer to my previous answer.
Thank you very much.
Yeah.
Okay. Are there any other questions or comments on the Governor report backs? No. Missed anyone? Thank you. So those are received and noted. Responses to Governor questions. I have got down here that there's no questions raised. So that item is noted, and we move to any other business. Michelle, were you going to raise something? Michelle Hughes here.
Yes, please, Chair. And it's thank you. It's just due to the timing of the COG meetings. If I could just verbally update the council on some work that will be starting over the coming weeks and months. So as some of you will know, trusts have to undertake an external review of governance, and this is under the NHS guidance, which is called Development Reviews of Leadership and Governance using the Well-Led framework. So these need to be carried out to a maximum of every 5 years, and our last review was undertaken in May 2017. So we've been working in the background, and we've now engaged with Grant Thornton to undertake our review, and that will start before Christmas, and it will include a series of meetings, observations of meetings and committees and individual interviews. So it was just to highlight to the council that this work will start to take place, and as these requests for information and meetings come through, I will feed them through as quickly to members of the council as required. So a paper is being prepared for the October Trust Board, which will provide a little bit more detail, and it will be shared with the council. But it was just to kind of highlight at the first opportunity that this work is about to commence.
Thanks, Michelle, for that. So there'll be more of that coming down the track, and obviously that was really good to raise it today, because the next Governor meeting, Council of Governors meeting, probably coincides with the external review starting properly. So thank you for the heads up on that. Okay, unless there's any other business from anybody. Thank you very much for your attendance and participation today. I look forward to seeing you all again soon, before the next Council of Governors meeting, I'm sure. And have a great week, everybody. Thank you.
Thanks, Caroline.
Thanks, everybody. Thank you. Bye.
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 Bye-bye.